And welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kim Downey. She's a physician advocate, and she brings together Michael Foti, internal medicine physician, and Tushar Bhagat, a research assistant professor. We're going to talk about the KevinMD article, how to support physician wellness during the toughest times. Kim, Michael, and Tushar, welcome to the podcast by KevinMD.
Thank you.
Perfect. Kim, you're on many times, and thank you so much for bringing these guests together. So what brought you and led you to Michael and Tushar?
Sure. So last spring, Michael and Tushar each reached out to me, and Michael shared that we're both advocates for physician wellness. And Tushar said he found me on one of Dr. Jonathan Fisher's posts and that we both care about physician well-being. And he commented on my cancer journey, sharing that he's in a cancer research career. And I Zoomed with Tushar and then Michael the very next week, and I thought that they should meet. So I had them on my YouTube channel together.
Excellent. So, Michael, you're an internal medicine physician. Just briefly share your story and journey.
Yeah, definitely. So, yes, I'm an internal medicine physician. I trained during the COVID-19 pandemic. It was actually that first wave of COVID arrived during my intern year, kind of the back end of my intern year, which is the, first year of residency, which, suffice to say was a very chaotic time. Many patients suffering and dying, many of whom were quite young. And on top of it, around the same time, my mother passed away quite suddenly due to complications of stage 4 lung cancer. So it was a very difficult time for me. And once I graduated from my residency program, my personal journey with mental illness began. I developed quite a severe anxiety and depression due to just unprocessed grief, unprocessed emotions, and it went on for months. And I suffered in silence for quite a long time, a large part due to the stigma of mental health. And I was afraid to really speak up and get help and really even accept what was going on. Eventually, though, I did get help. I started on an antidepressant medication. I started seeing a psychologist. I took a medical leave to take care of me finally. And honestly, it was the best thing I could have done. And I'm in a much better place for it. And because of those experiences, I've become very much a passionate advocate for mental health awareness and especially physician wellness, and especially those training to become a physician as well.
All right, Michael, we're going to touch upon that story, and I have a few questions about that in a bit. But before we do, Tushar, can you introduce yourself? Tell us a little bit about your story and journey.
Yeah, sure. I'm happy to be here again, Kim, Michael, and with you, Kevin. So I'm primarily a cancer researcher, a translational researcher, where we do lab research, plus we have clinical trials that has led to some therapies in the clinic now that they're being used. But while doing this, I got a chance to interact with patients and medical students for a decade while I was teaching the students and bringing in mindfulness during respiratory system lectures when they found me out that I'm teaching meditation. Yeah. But when I was teaching mindfulness to the cancer patients who are on our own clinical trials, and this is what hit me, they said, "Thank you for keeping us alive through your research and the treatments you'll come up with. We'd love to learn how to live." That's why they came to the mindfulness program. And from there, I saw what meaning, purpose, and joy they got from being aware, developing awareness. So that's basically my work. But besides doing meditation, I wanted to bring some more understanding through the lens of science. So I got trained at Brown to the most validated, scientifically, clinically tested meditation program called mindfulness-based stress reduction, for which I'm a facilitator and a teacher trainer for various organizations. But because I was being in the medical field and medical research field, medical education field, I had this desire to bring this to, let's say, my tribe, if you will. Yeah, because I'm able to relate with them more so. But through the understanding of neuroscience, the understanding trust and validity, and therefore willingness of the tough scientists and physicians who tried to their own benefit, I've been seeing those for a number of years now. I'm happy to be continuing to do this work with advocates like Kim, Michael, and yourself.
Perfect. So, Tushar, let me follow up on that. So, you talk about mindfulness-based stress reduction. Just for those who aren't familiar with that, just tell us exactly what that is and how that specifically can benefit physicians today.
Definitely. So, mindfulness-based stress reduction is a program that began at University of Massachusetts Medical Center by an MIT-trained molecular biologist, John Kabat-Zinn. It has three basic elements. It has formal meditation practice, where you sit and meditate quietly, informal meditation practices, where you integrate movement with meditation and your regular day work, and then integrative mindfulness, where you're actually applying the principles of mindfulness to your day-to-day life to
Mhm.
see whether it works and how does it help you. So this has been started since 1979. So this is 45 years of primary research articles and clinical trials, like published in JAMA and such, to show the evidence, mainly practiced in the medical setting. So it's very relevant to, let's say, our people, if you will. Yeah. And besides this research and clinical trials, I've met people such as Kim. Like it's different when we meet a person in real time and
Mhm.
see what is it doing to them through this program. So that's basically what MBSR is. And the research continues to go on, clinical trials continue to go on to not only reduce, let's say, the fines incurred through medical malpractice due to burnout. Yeah, that's what institutions are interested in. But I care more about the person itself. Yeah,
Mhm.
while they are taking care of people, somebody needs to take care of them in all the possible ways. And this is one of the ways that is very well validated and tested. While the system changes, they can still do this. Yeah.
All right. Michael, when you were telling your story, you were telling us about a difficult time, especially during COVID, and then you had a lot of personal tragedies affect you as well, all while doing residency, right? So just give us a sense of what was it like during that time, during those days while you're on the hospital wards with everything, those stresses around you. Just give us a sense of what it was like during those days.
Yeah, thank you, Kevin. Yeah, it was extremely chaotic to say the least. To kind of give some context to that, I was part of the RRT team, or rapid response team, which responded to emergencies in the hospital. And, pre-COVID, our hospital maybe got one or two RRTs called a day, right? But at this height of the first wave of the COVID-19 pandemic, you're talking about one or more an hour, right?
Mm,
Almost always the case being one of our patients' oxygen levels dropping.
yeah.
So there was no stopping, right? It was constantly in and out of patient rooms trying to stabilize their patients, more often than not, having to then transport our patients to the ICU. And what made this even more devastating was most of these patients were young. I mean, they were in their 30s and 40s for the most part. Oftentimes, we had families admitted at the same time in the hospital in different rooms who couldn't even see each other. I even had a patient whose wife was in another room from him, and she got discharged, and a week later he passed away, and they never got to see each other again. These were the types of things that were happening. And so, yes, it wasn't personally happening to us, but as someone very involved in the care team, it was devastating to witness, and really had a mental toll on all of us. And again, it was very much akin to a war zone, because it was something devastating like that happened, but you couldn't stop for a moment to even process it, because then you had to then jump to the next emergency. And so it was emergency to emergency, and it was just a very difficult time.
And Michael, in terms of that stress and that journey, it eventually led you to a place of burnout and eventually seeking help, right? Because a lot of physicians, when dealing with behavioral health stresses, they often don't seek help. So what was it in your case that led you to seek help and kind of make that turn in your path?
Yeah, definitely. Thank you for that question. So it was kind of my body made that decision for me. So I had probably the worst panic attack up until that point. I had been having nightly panic attacks for months when it all started, where I would have a very intense chest pain, akin really to a heart attack. My arm felt like someone was squeezing my left arm off. But there was one night particularly, this was December of 2022, where I had the worst panic attack. It would not go away the symptoms. I thought, well, maybe this is my heart. So I had my wife bring me to the emergency room. They did all the testing imaginable, and everything was fine. Finally, I requested to see a psychiatrist because, as a physician, I knew this has to be, if it's not my heart, this must be something else. And so
Mhm.
the psychiatrist, she was wonderful. She sat with me for hours, and we just spoke about really just experiences I'm telling you now, and everything that I dealt with. And, she looked at me right in the eyes and said, Michael, I'm not surprised. This isn't just stress from work. You have a lot of unprocessed grief. the loss of your patients, the loss of your mother. And this is manifested as, quite the severe panic disorder and depression. And so it was hard to hear, but I said to myself, well, if not for me, but for my son and my wife, I needed to get help. And that's when I finally decided to stop taking care of others, meaning my patients, take a medical leave and take care of myself.
So, Kim, when you're hearing Tushar's work with mindfulness-based stress reduction, and you're hearing Michael's story about how he overcame behavioral health issues and now he's openly sharing his story, tell me the connective tissue between both of those stories. What made you bring them together here? What are some similarities between what Tushar does and Michael's story?
Yeah, sure. So when I spoke with Tushar first, and when we had our conversation, he was just like so kind. And, when I was hearing him speak and how he taught in the medical school and he witnessed the stressors of the med students, and then as it progressed to residents, and then now that he supports medical professionals in teaching mindfulness. And then the very next week, when I spoke with Michael, and, he's working hard to end mental health stigma in medicine by sharing his personal story. And I was thinking, oh my gosh, they should meet. And also, even geographically, they aren't so far from each other. And we had connections. Michael's only about 45 minutes from me, and Tushar's at Albert Einstein. And I did some, work there as a PT student. And then he has a friend who lives here in Connecticut. So it just felt like we were all connected.
All right. So, Tushar, let's get back to mindfulness-based stress reduction. So, give us a story or an example where a physician or medicine student instituted some of these techniques and that really helped them reduce some of their stress and potential path to burnout. Tell us a case study or a story.
Yeah, this is when it comes alive. Thank you, Kevin. So, without naming the physician, I had several physicians in this course, one of them somewhere on the northeastern coast in his residency time right now and taking this course. So, Michael did a great job describing his life actually. So, whatever Michael just said, everything was happening to this resident.
Mm-hmm.
Long work hours, having physical symptoms that were unmanageable for him, that led to more difficult interactions between his juniors or his seniors attendings. Yeah. And that led to more complications that we have to deal with, more physiological reactions, panic attacks, and so on, anxiety. And in that, not being able to be present for the patient. He outright said that, I don't feel anything about anybody. There's someone dead, they admitted that I don't feel anything.
Mm-hmm.
So their ability to be empathic, yeah, that kind of got lost. So apathy kind of set in. But then when they sat down to think about this, they found some meaninglessness in life. They are doing more harm to themselves and others. But now, having done this program for 9 weeks, yeah, 8 to 9 weeks, daily practices, weekly 2.5 hour session, 3 different ways of practicing it, slowly, what really transformed in them is they developed this space of awareness just before the reactivity. Yeah. So if I were to talk on neuroscience, their amygdala started reacting less, the reactive part of our brain. And the prefrontal cortex that makes logical decisions, that kind of set in and activated in that space when they were able to think even for a few seconds or a minute before they acted. That had huge impact on the consequences they had in personal relationships with their patients. People saw transformation in them in a way they said, oh, I don't recognize this person so much now, in a good way. They're not getting upset, angry, mad, or running away from conversations like they used to, yeah, whether on email or whether in person. So there's a snippet of that. And this is a person who actually really worked very hard. They followed the practice to the T and then saw the outcomes that have been already tested for a long time. But it's only seen when the rubber hits the road, when people do it. Just like any prescription, to use the medical analogy here, the doctor, Michael, might prescribe somebody, but until people open and take those prescriptions just as guided, they would not see the effect. So it's similar in mindfulness.
And Tushar, if someone was interested in learning more about these techniques in your program, where can they find more information?
So they can find information through me on LinkedIn, or they can find information on the Brown University website, University of California, San Diego. and then several other institutions like the Mindful Northwest, where I'm associated with and who actually are leading the MBSI program in the country.
All right. Michael, so getting back to your story, what was your ultimate goal in terms of sharing it? What do you hope to accomplish and change by sharing your story, being on this podcast, and talking about what happened to you?
Yeah, my initial reason for sharing my story was I knew that I wasn't alone in my story. I knew there were other stories very similar to mine. I knew that whether be it a medical student, a resident, or intending physician, or really anyone in the health workforce, there were many who were suffering in silence. And because I knew what that felt like, I knew that if I could share my story, potentially resonate with someone else, that could then empower them to get the help that they need and not feel alone, not feel scared to get the help that they need. And my mission is to raise awareness about mental health, especially in the medical community, to get rid of the stigma that
Mhm.
exists and really create a safe space for everyone everywhere dealing with mental health, but especially in the health workforce to feel safe and empowered to get help when they're dealing with this and hopefully really change the culture of medicine for the better.
And Michael, can you share a story or a case study where someone heard what you went through and it made a huge difference in their life and changed their path as well? Is there a story that you can share with us?
Yeah, definitely. So, I've been speaking in many institutions and many medical schools, and I had a student reach out who said after hearing my story, you know, they were afraid to speak up because they felt that they were going to need extra time for their board exam. Oftentimes students are granted accommodations for whatever reason, that they need more time on their board examination. And the student was afraid to speak up about why they needed that extra time. And
Mhm.
they didn't want to feel, kind of isolated because they spoke up and, obviously the stigma that they were felt afraid. But after hearing my story, they immediately went and shared why they, for, whatever personal or health reason they needed this extra time on their board examination, went and were granted that accommodation. And again, felt empowered to do so after hearing my story.
We're talking to Michael Foti, Tushar Bhagat, and Kim Downey. Michael's an internal medicine physician. Tushar is a research assistant professor, and Kim is a physician advocate. The KevinMD article is How to Support Physician Wellness During the Toughest Times. Now I'm going to ask each of you just to share some take-home messages to my clinician audience. We'll start with Tushar, then Michael, and end with Kim. So Tushar, why don't we start with you?
So I would say, speaking of like, I heard Michael use the word empower. Yeah. So I'm going to go with that. So I'd say the can be still empowered with the tools that they have within them, their brain and body until the system changes. Yeah. Through more advocacy. And what I mean by that is they can still do a lot of these validated mindfulness practices that might not take away too much time from their life, but might have a huge impact on their well-being. Yeah. To say they should trust the science, learn about it, and then try it for themselves. And then come back and see what they want to do, continue or shift, change.
Michael, what are some of your take-home messages?
Yeah, one of my biggest ones is always that healing starts with self-compassion, right? So to love oneself is to take care of oneself no matter what. So I want everyone dealing with mental health, whether you're the health workforce or not, know that you're not alone and know that it's not a weakness to be suffering from any form of mental illness. And in fact, the strongest thing that you can do is to get the help that you need because you cannot be a healer if you first do not heal yourself. And you can't be your best self for whatever profession and just for your loved ones if you're not your best self. So please, take care of yourselves and just be kind to yourself that, it's okay to not be okay.
And Kim, we'll end with you. Just leave us with your take-home messages.
Sure. One is we didn't get to touch on Cafe Foti, and I'm hoping that you'll all reach out to Michael so he can tell you a little more about it. But basically, he has an hour a week at least where med students, and actually they can come in any time and get a drink and a snack, and he has an hour where he's just there for them. And I think that is so beautiful and wonderful, and I hope it could be replicated in many ways around the world. So reach out to Michael and find out more about Cafe Foti. And the other thing is I was thinking about what I wanted to say is reach out and touch someone. And that was like a phone commercial in the 80s, but that was like 40 years ago. So Michael might not be aware of it, but it made me think of like literally and metaphorically. And my son's first grade teacher would always ask the kids every day, do you want a hug, a handshake, or a high five? And with my own doctors, mostly we've shared a hug, a handshake, or a fist bump. And I never do that without smiling. It just means a lot. And whenever I meet a doctor in person, we always share a big hug and metaphorically connecting. Tushar and Michael reached out to me, or I reach out to other doctors. And then we had that conversation and they wanted to keep the conversation going, which is, why we're doing this today. So just reach out and touch someone.
Well, thank you all for sharing your stories, journeys, and perspectives. And thanks again for coming on the show.
Thank you, Kevin, for having me.